A recent study from New York University School of Medicine found that a deadly pregnancy complication rose by 25%. Probably not what you're thinking. The complication, a heart attack. Yeah, a spike in heart attacks in pregnant patients. And I'm gonna let you two go back and forth on this. Dr. Nita, we know the pregnant body undergoes a lot of physiologic changes. Absolutely. That could explain the increased risk of heart attack.
Right, so a lot of things happen when a woman is carrying a baby. So for instance, there's an increase in the blood plasma volume, the resting heart rate goes up, the cardiac output increases 30 to 50%. So the heart is working really hard to support the pregnancy. But with this particular study, researchers analyzed about 50 million pregnancy-related hospitalizations. And when they looked at things, they couldn't really pinpoint exactly why the increase happened, but there are a couple of potential reasons. For instance, we know that women are having babies at older ages, so older age, increased probability of heart attacks. Also, more women are obese with issues like diabetes and things like that. But there are other factors that came into play as well, because a lot of those women that had the heart attacks didn't have those risk factors. But I want you to jump in. But before we do, I do want people to realize at home, overall, the probability of having a heart attack during pregnancy is still low. However, the fact that there was a 25% increase is still alarming, and that's something we definitely want to look closer at.
Yeah, and on one hand, it's really surprising that, you know, women that are pregnant we're seeing an increase in risk of heart attack, but it's also an important reminder that heart disease is still the leading cause of death in women. And the reason we're seeing this, I think, is, as you pointed out, Dr. Nita, is that women are having, you know, babies later, and age is an independent risk factor for heart disease. We're also seeing a rise in diabetes and obesity, as you said. And then another interesting sort of phenomenon that happens in pregnancy, in addition to the ones you pointed out, increase in cardiac output, increase in blood volume, which means we have too much fluid in our body, and a lower blood pressure because the blood vessels become more relaxed, is that we see this dramatic increase in hormones. We see progesterone rise to higher levels, and progesterone is a hormone that weakens the blood vessel wall and makes it much more likely to split and tear, and can cause a process known as spontaneous coronary artery dissection. And when the blood vessel tears in these small tubes that feed our heart muscle, the blood vessel becomes blocked, the muscle then is starved of oxygen, and you have a heart attack. So that happens more commonly in pregnancy. And then there's two other interesting phenomena that we see more commonly in pregnancy, and that's pulmonary embolism. And that's where our blood becomes thick and sticky, and it first forms in our legs, and then that clot mobilizes and it lodges in our lung to cause a pulmonary embolism. And then the final, you know, interesting sort of phenomenon that we do see more likely in pregnancy is a process known as peripartum cardiomyopathy. Yeah. And that's where our immune system goes crazy and attacks the heart muscle and weakens it and can cause what's called congestive heart failure. Yeah. So all those things are why we really should pay attention to symptoms during pregnancy: chest pain and shortness of breath.
Yeah.
Anything before we go to break as a pregnant patient that they should be doing differently because of this, or is it just be healthy, obviously, work closely with your obstetrician and gynecologist, and if you have any symptoms, shortness of breath, chest pain, or just not feeling quite right?
I'm not the expert, but obviously if you have any family history, and if you're in a high risk group and you identified what issues could put you at higher risk,
have the conversation.
Then you know, monitoring your cardiac status has to be a big part of that pregnancy.
Really important. And also, you know, when you go to your prenatal checkups, make sure you pay attention to your blood pressure, know what normal is, and you should, you know, really achieve that normal goal. Check your blood sugar, know what yours is and what optimal is, and check your blood cholesterol, because that's gonna help you have a happy, healthy pregnancy and then after.
And ideally, you can have preconception counseling so your doctor can go over all of this before you get pregnant. And a big thing, you hit on it, Dr. Ordon, know your family history. A lot of times, Aunt Jane won't want to tell you she had a heart attack because she doesn't want you to worry, but you need to know about Aunt Jane's heart attack because it could be impacting you genetically, right? So you want to tell your doctor about that. So in general, as families, have the conversation.